are administered, laws are enacted, and judgment is decreed. Assist with your spirit of counsel and fortitude the members of this legislature and of this hallowed unicameral of the state of Nebraska. Let the light of your divine wisdom direct the deliberations of this chamber and shine forth in all the proceedings. May they seek to preserve peace and promote the well-being of Nebraskans. May they be enabled by your power to discharge their duties with kindness, honesty, and ability. In your goodness, you have favored us and kept us safe in the past. We ask that you continue to protect our citizens and to shelter us in the shadow of your wings. May our state be a place of peace, hope, progress, and equality. Bestow upon us countless signs of your love. Grant that as we receive your gifts, our neighbors may share in your gift to us and also share in our joy. Your loving response far exceeds the merits and expectation of those who pray to you. Loving God, who is blessed above all, bless you in all things through Christ, so that whatever happens here may renew and sanctify and bless our people. And may your abundant graces descend upon those present in a special way among our people, you who live and reign, God, forever and ever. Amen.
Leading the Pledge of Allegiance today is Senior Airman Ryan McDonald, the 155th Civil Engineer Squadron of Nebraska Air National Guard of Air Force out of Omaha, Nebraska, Senator Mike McDonald's district, and also Senator Mike McDonald's son.
Please join me in saying the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. I call to order the 31st day of the 108th Legislative Second Session. Senators, please record your presence. Roll call. Mr. Clerk, please record.
There's a quorum present, Mr. President.
Are there any corrections for the journal?
I have no corrections this morning, sir.
Are there any messages, reports, or announcements?
There are, Mr. President. Communication from the governor. Engrossed legislative bills 139E, 144, 257, 569E, 605, 624, 716, 847, 848, 854, 908, 909E, 936, 940, and 989 were received in my office on March 7, 2024, and signed on March 11, 2024. These bills were signed and delivered to the Secretary of State on March 12, 2024. Signed sincerely, Jim Pillen, Governor. Your Committee on Health and Human Services, chaired by Senator Ben Hansen, reports Legislative Bill 1007 to general file. Additionally, your Committee on Business and Labor, chaired by Senator Reapy, reports Legislative Bill 1188 to general file with committee amendments. Additional communications from the governor concerning appointments to the Health Information Technology Board, as well as the State Board of Health. Amendment to be printed from Senator Brewer to LB 287 and Senator Jacobson, LB 1087A. That's all I have this morning, Mr. President.
Thank you, Mr. Clerk. Senator Michaela Cavanaugh would like to recognize the Doctor of the Day, Joe Miller, who is underneath the south balcony. Senator John Cavanaugh would also like to recognize Sonia Pazurski of Omaha underneath the south balcony. Please rise and be recognized by your Nebraska State Legislature. We will now proceed to the first item on the agenda. Mr. Clerk.
Mr. President, Senator Hunt would move that LB 307 become law, notwithstanding the objections of the governor.
Senator Hunt, you are recognized to open.
Thank you, Mr. President. Good morning, colleagues. Good morning, Nebraskans. You know, it won't surprise a lot of you to hear that I'm not sure what I'm going to say today. I know I have 10 minutes and I have plenty to talk about. But, you know, I'm a ball of nerves. I honestly cannot believe what's happened to this bill in the last week. And, you know, it's one of those situations where I can't say that I didn't do everything in my power to make it work. And how can anyone ask any more of me than that? And I know that many of you are frankly just committed to misunderstanding the bill. You're committed to misunderstanding it. I rose above the nonsense of last year this year. I played it straight. I have been a model colleague to all of you. This bill went through 3 rounds of debate. It came out of the committee with full support. We modified the bill with an amendment to fix problems concerns that people had about the bill. We played it straight. We did it right. It's a good bill, and you understand the policy more than Governor Pillen does. In this legislature, we stand together as a family. We make the choice to trust each other, to trust the committee process, to trust the experts that come out and tell us that this is policy that not only Nebraskans want, that our localities want, but that's going to save lives. And in this legislature, I don't know if some of you understand that we take that seriously, and that doesn't mean that we allow the executive branch to tell us how we're going to act at the end of the day. If you're afraid of your bill getting vetoed too, guess what? We override that too. It's not a big deal at the end of the day. And I know better right now than to think that a lot of you have questions that I can answer about the bill, yet I stand ready to answer them. And I will also, certainly go over what this bill actually does. But I also want to talk about the broader implications of this vote for this legislature. This bill is the first veto of the year, but yours could be next. We are an independent, co-equal branch, and you work for your constituents who trust you. And I've shown you that you can trust me. And if you don't want to trust me, you can trust people like the Chancellor of UNMC, the Director of the Addiction Psychiatry and Public Health at UNMC, Dr. Jerome Adams, who served under Governor Mike Pence during Indiana's HIV outbreak and then became Surgeon General under President Trump. You can trust Dr. Ali Khan, MD, MPH, MBA, former Assistant Surgeon General, the 3rd Dean of the University of Nebraska Medical Center College of Public Health, the former director of the Office of Public Health Preparedness and Response at the Center for Disease Control and Prevention, the CDC, which says this is a good bill. Many of your county public health directors, the pharmacists, the Nebraska Medical Association, the behavioral health providers, and Nebraskans with lived experience in recovering from substance abuse. This veto is not about me. It's not about your feelings about me. It's about Governor Pillen's feelings about me. And we know that because Governor Pillen said to many of you, who then came and told me, that this is personal for him. How come this came out of committee? How come it went through 3 rounds of debate? How come before we got to final reading, I had 38 yes votes on my card? But at no point in that time did the governor come up to me and say, this is going to face a veto, let alone say it's going to face a veto, and here's an amendment I would like to see you consider. Here's an idea to make it better. No, he didn't say anything to me like that. He just trashed it. And many of you went, oh, he must have a good reason. He told many of you the reason. He said, and I quote from one of you, I don't know why any of you are working with Hunt this year. We can't let her have anything. So if you think you've received some evidence that 44 other states, the Surgeon General under President Trump, this, that, and the other, that you know better than those people, by all means vote no on this override. But just be clear that that's what you're doing. It's not because you know better. People can just be committed to misunderstanding, and that's a really big barrier to overcome. So, Governor Pillen, in his veto letter, in his things that he's published online, this and that, he has cited a lot of misinformation in his reasoning for vetoing the bill. He cited 2 articles written by the same author, an economist, Annalisa Packham, and the paper is rife with methodological flaws, design limitations, ecological fallacies. It has artificial correlations. One of the papers is a working paper that was not approved for publication, and the other one is a newer version of the same paper, which is being examined and critiqued by other academics due to questions they have about the validity of the study. Another concern that I hear from many people is, oh, this is going to turn us, I'm hearing this a lot from up here, this is going to turn us into San Francisco. Okay, San Francisco, population 8 million. Y'all wish it was San Francisco. Think about the tax revenue you could get with your Epic tax if we had 8 million people here. Please be serious. Denver, 3 million. Portland, 6 million. Passing this bill to allow local jurisdictions with the support of their city council or village board, which do you think that's going to be easy? You think they won't have opposition to that to overcome? Can pass a syringe service program under LB 307 that will be managed by a behavioral or public health clinic. Do you think behavioral and public health clinics that are run by your localities, who you trust when you're dealing with a healthcare related bill, who talk to you out in the lobby and then you come in and vote their way because you're convinced by the evidence, do you think that those same people are handing out needles to kids, as Governor Pillen has fear-mongered and said is the case? Be serious. Be serious about the work in here. That's all the bill does. It doesn't say someone can open up a tent at 72nd and Dodge and hand out free needles. City council has to approve it. That's not easy. Has to be run by public health org. And nothing in the bill forces your community to have this. But if you vote to keep this veto, if you don't vote to override, you're taking the opportunity away from localities that do want this. Most of your public health districts have seen a rise in fentanyl use and opioid abuse, opioid use. And Nebraska is one of the only states that has seen a rise in HIV and hepatitis C when the rest of the country is going down. So what are we going to do about that? Some of you have said, well, I agree that we need to do something about addiction. We need to do something to get people into treatment. Mr. President, how much time do I have? Matt, how much time do I have, Mr. President? Okay, forget it.
1 minute.
Thank you. Wow. A lot of you have said, we want to do something to get people into treatment, but this isn't it. Okay, so what is it? Governor Pillen has released his budget recommendations, and the budget recommendation includes a $15 million cut to behavioral health aid, totaling $30 million across the biennium. That's an 18% cut in each year from what was approved in last year's budget. So what is that money going to go for? That's money that would go to substance abuse and addiction treatment. But we have a bill before us today, LB 307, that costs nothing to taxpayers. It is free. So if you're serious about facing this problem, trust me, your constituents trust you, trust the process that we went through here in this legislature, trust the more seasoned senators in this body who know from their experience that this is a good bill, and trust the experts who know that this works to treat addiction. That is the whole point. Thank you, Mr. President.
Thank you, Senator Hunt. Senator Arch, you're recognized to speak.
Thank you, Mr. President. Colleagues, I've supported this bill through general, select, and final reading. I introduced an amendment that was passed on select to provide further guardrails to the program. I did considerable personal research on this issue because I was, frankly, like many of you, skeptical at first. When the governor vetoed the bill, I did further research to test my understanding. My conclusion after further research is that this is a bill that I will continue to support, and I support the motion to override the veto. First, let me frame the debate. To me, this is strictly a disagreement as to what is the best policy for the state of Nebraska. It's not political, it's not personal with me. I have heard it said there's room for disagreement between reasonable people, and that is how I perceive this. So what does this bill do? The primary purpose is to allow elected officials, to decide if an SSP program is right for their community, and if they decide to implement a program, it must contain essential elements that are written into the bill. It doesn't require, nor does it fund, it simply allows. Colleagues, I think there is a misunderstanding of what this SSP is. It is framed within what is called harm reduction strategy. It is not a standalone program. It's a piece to address the issue of the spreading of communicable disease, the use of fentanyl, opioid crisis, all of those things. It's a piece of that harm reduction strategy. I want to read to you something that was published on August 11th, 2022. The National Governors Association published a document by their Center for Best Practices, the National Governors Association, all governors members, and it's entitled Supporting and Sustaining Access to Harm Reduction Services for People Who Use Drugs. This is a document produced to guide states through the consideration and implementation of SSPs. Quote, governors, state health officials, and their staffs can continue their predecessors and constituents' work to reduce the spread of infectious diseases while saving money and resources by investing in sustainable, accessible harm reduction programs such as syringe services programs, SSPs, the program that we're talking about here. The latest information I could find indicated that Nebraska is one of only 5 states now to not allow an SSP program in the state. Those states that are still not allowing: Kansas, Mississippi, Nebraska, South Dakota, and Wyoming. So as part of my research, I turned to experts in the field to inform me. Obviously, with 45 states now allowing SSPs to exist, we can take advantage of the experience of others. One of the most prominent proponents is Dr. Jerome Adams, Executive Director of Health Equity Initiatives, Presidential Fellow, Distinguished Professor of Practice at Purdue University. He's a licensed anesthesiologist with a master's degree in public health. Prior to joining Purdue University, he served as the U.S. Surgeon General under President Trump and as the Indiana Health Commissioner under Governor Mike Pence. While serving with Governor Pence, he worked with the Indiana Legislature and the governor to legalize SSPs in Indiana in 2015. I was very interested in his opinion, given his strong conservative credentials. Dr. Adams sent me a letter on January 26, 2024, expressing his support for our efforts to allow SSPs in Nebraska, and he laid out his rationale. A copy of that letter has been provided to you this morning. I also read his article in 2020 that was published in Public Health Reports while he was Surgeon General in the Trump administration. The title of that article was, quote, Making the Case for Syringe Services Programs. I'd like to read you a portion of that letter
1 minute.
to me. While the provision of sterile syringes is absolutely essential to combating HIV and hepatitis C, these programs represent so much more than syringes. As with our efforts in Indiana, SSPs that would be authorized by LB 307 can build trust and empathy with community members struggling with substance use disorder. They can create pathways to treatment and recovery, and they can distribute overdose reversal medications that save lives every day. With that, I will stop my testimony and look forward to the next chance on the microphone. Thank you, Mr. President.
Thank you, Senator Arch. Senator Brandt, you're recognized to speak.
Thank you, Mr. President. Thank you, Senator Hunt, for bringing LB 307 and shepherding it through 3 rounds of debate. Thank you to the Judiciary Committee, where it came out with 7 affirmative votes and 1 PMV, and the PNV is no longer in our body. Senators Blood, DeBoer, DeKay, Holdcroft, Ibaugh, McKinney, and Wayne. Thank you for voting this bill out of committee. So, yes, I stand in support of the bill. I stand in support of the motion override. Everybody in here wants the same thing. There is a common theme here, and that is to help people in the state of Nebraska. I received a lot of emails, for some reason, a lot of them from Bellevue. I don't really understand that. But everybody is afraid for our children, and there's going to be needles everywhere. And this bill does quite the opposite. This bill is about two things: local control. You will not get an SSP program unless your city council or your county commissioners vote to have this program. And then your local public health agency is the one that would administer this program. In Nebraska, the drug problem is not just in the cities. I can vouch for that. There are areas in rural Nebraska where we constantly fight this drug issue. And I really, hats off to anybody in here that brings bills to help the addicts, that brings bills to fight the dealers. You know me, you know I've been supportive of those. And I think this bill takes a very small step in a direction to help our addicts out there. And, you know, there's lots of addictions out there. You know, we've got alcohol, we've got drugs, and this one helps to keep us all safe. It costs nothing to the taxpayers, and like I said, it helps those with addictions. And a lot of the bills, a lot of the emails I got reference San Francisco. Let's put this in perspective. If you take the state of Nebraska, South Dakota, North Dakota, Wyoming, and Montana, you're still smaller than the city of San Francisco. So there really is no correlation with that. So I would yield the rest of my time to Senator Hunt.
Senator Hunt, you're yielded 2:27.
Thank you, Mr. President. Thank you, Senator Brandt. I give my very warm gratitude to you and to Senator Arch for what you've said already. One thing I think must be said is that syringe service programs will not worsen drug use. This is not authorizing addiction or encouraging addiction or validating drug use. People who say that we are enabling drug use are misinformed about how addiction works, and they haven't considered the evidence from other programs. Addiction is a disease that physically rewires you, that physiologically changes you, and most people need help to overcome that. Failing to override this veto is doing nothing. I heard Senator Bosin saying in her fentanyl enhanced penalties bill, we can't do nothing. We cannot do nothing. If we do not override this, we're doing nothing. We're retaining the status quo, and we're letting people facing addiction continue what they're already doing to survive. That means a much higher likelihood of dangerous injection behaviors, like needle sharing or overdosing. Or we can allow localities in Nebraska, with the authorization of their constituents, of their governing boards, to create places where these addicts will be receiving a bridge to treatment for the first time. Thank you, Mr. President. When users want to relieve their withdrawal symptoms or their cravings, they're going to find a syringe to do it. And I want you all to think critically about if that's a needle that their friend gave them on the street, if it's something that's from someone who may be HIV positive or carry another disease, if it's a needle that's been used many times already. As policymakers, we have a choice here. We can look at the reality of the situation, the overwhelming volume of evidence, what has worked in 44 other states. All our state's top experts and medical science experts have come around this. And I urge you to listen to what these experts are saying and say, what's the most effective solution? Doing nothing? The status quo? More needles on the playground, Senator Eibach? Or passing LB 307 to put these people in the hands of public health organizations that are equipped to help them get treatment? Thank you, Mr. President.
Thank you, Senator Brandt and Senator Hunt. Senator Frederickson, you're recognized to speak.
Thank you, Mr. President. Good morning, colleagues. Good morning, Nebraskans. So today, this is actually, I think, a really big morning for this body. And I think it's a really important morning, and it's an important day for the members of this body, and specifically what it means to be a legislative leader. So I'm going to be paying very close attention to the board today. And I would strongly encourage Nebraskans, and I would also encourage my colleagues in this body to also pay close attention to the board as well. I'm going to be paying particular attention to colleagues who have supported this bill and voted green on this bill, spoken support on the mic of this bill for 3 rounds of debate, who supported and passed this policy into law, knowing that it was for the betterment of the public health of our state, and who now come off, not because of a change in the policy, but because of a signature. And let's be very clear. I imagine I'm not the only one paying attention. The executive branch is going to be paying very close attention today as well. They too are wondering who in here is a legislative leader, who's willing to stand up for the legislature, who's willing to maintain the core of democracy of separate but equal branches of government and power, and who will bend over with a little text or a phone call. Leadership in this body requires standing up and defending the legislature. We have great examples of that in this body and some of our senior members, Speaker Arch, Senator Linehan, folks in here who have survived and weathered a number of vetoes by our former governor, Governor Ricketts, and who voted to override those vetoes because they knew policy was more important than politics. Civics, democracy, separation of powers. I'm going to shift a little bit to the actual policy of this bill, and I think Senator Hunt and Speaker Arch and Senator Brand have certainly done a nice job of highlighting some of this. Earlier this year, I was at a conference, a bipartisan conference on best practices of opioid policy, because whether we want to acknowledge it or not, the fentanyl crisis, the opioid crisis is nationwide, and it's impacting Americans everywhere, and it's impacting Nebraskans everywhere, and particularly Nebraskans in rural parts of our state. One of the things that came up often, and Speaker Arch spoke to this, was that Nebraska was one of 5 states that does not allow for SSPs. And some of the most conservative members at this policy forum came up to me in shock at this.
1 minute.
Thank you, Mr. President. And they shared stories from their own districts, from their own constituents, in their own areas, where they saw benefits and improvements in public health after passing this policy. We know that Nebraskans are suffering, and we know that there is high levels of stigma with substance abuse, which is maybe why we're not talking so much about it. I know I've been given my minute warning. I have a lot more to share on this, so I'm going to get back in the queue and wrap up there, but I will continue with my thoughts in a bit. Thank you, Mr. President.
Thank you, Senator Frederickson. Senator Merman, you're recognized to speak.
Thank you, Mr. President. I have listened very closely to the debate, the 3 rounds of debate, and also have done the research as best I can on this subject. And I've come to the conclusion that there is a disagreement among the medical professionals that have researched it and among government officials. And I think in the most recent articles that I can find, the professionals are swinging back toward not enabling drug use in any way. Senator Kauth has passed a article around, and I have it on my desk also, And it was published, Senator Senator Hunt did reference this article in her opening, and it's published by The Economist, and it is titled "America's Syringe Exchanges Kill Drug Users, but Harm Reduction Researchers Also Unwilling to Admit It." The article looks primarily at a 2022 study by a professor from Vanderbilt titled "Syringe Exchange Programs and Harm Reduction: New Evidence in the Wake of the Opioid Epidemic." I also have a copy of that study here, and I would encourage you to take a look at it if you are unsure on this issue, as I have been through the 3 rounds of debate, as I've been present, not voting. The author of this study finds that while syringe exchange programs did lead to lowering HIV rates, they led to a spike in opioid-related mortality. Why? Because when the heroin crisis was building up and we saw these syringe exchange programs being created, fentanyl and other opiates were not regularly on the market yet. But as fentanyl became more and more common, we have seen more and more overdoses. The reality here is that HIV is no longer necessarily a death sentence, but an opioid overdose is. I don't completely disagree with Senator Hunt when she says that these sites can lower HIV rates, but my concern is that these sites can lead to continued or increased drug use. This becomes increasingly dangerous when the drugs on our streets today are more dangerous than ever. But don't take my word for it. Let's look to that Vanderbilt professor's research, where she points to 3 ways syringe exchange programs can promote continued or increased drug use. First, they distribute free supplies which lower the expected cost of the drugs. Second, they provide a safe space to interact with other drug users, which expands access to new drug partners and supplies reduced stigma. Third, they may signal support for police leniency of drug users, in turn lowering the legal risk for using drugs. So the research tells us 2 things. 1, due to the opioids such as fentanyl, drug overdoses are far more common and deadly than they used to be. 2, these drugs can promote continued or increased drug use. These programs can promote continued or increased drug use. So what we get when we combine these 2 factors is more deaths. I can appreciate Senator Hunt's goal to lower HIV transmission. That's a great goal. But with any bill, we have to weigh the costs and the benefits. And in this case, we're looking at the cost of more death. HIV can be treated, but there is no treatment for our Nebraskans who die of an overdose. With that, I'll urge my colleagues to look at the most recent research and oppose LB 307. Thank you, Mr. President.
Thank you, Senator Merman. Senator Duncan, you're recognized to speak.
Thank you, Mr. President. Colleagues, I do rise today in favor of the motion to override. I think we're getting a little bit off track talking about the actual substance of the bill. The time for debate with regard to LB 307 was on the 3 rounds of debate we already had. The fact that this is the first time we're hearing about concerns that people had with regard to some of these bills, or the first time that some of these so-called studies are being talked about, I think is problematic. Just quickly, America's syringe exchanges might be killing drug users is this article that was handed out on the floor. It's a paywalled article that doesn't have an author related to it. In addition to that, any study or article that uses the word junkies in reference to the people they're talking about using drugs, I think is just simply not credible. So this is just an opinion piece, and I don't think we should be giving it much weight. But I do think overall, a number of my colleagues have already made a lot of the points I would make, including Speaker Arch, and I would yield my time to Speaker Arch. Thank you, Mr. President.
Speaker Arch, you yielded 402.
Thank you, Mr. President, and thank you, Senator Duncan. I want to continue talking about Dr. Adams because I was very interested in the letter that he sent to me. So I read part of it. I'm going to continue. When local communities are empowered to authorize, design, and operate SSPs, they can do so according to local needs and conditions and in a way that builds partnerships with the public safety community, the business community, the faith community, and more. These SSPs can help people who are struggling to make safer choices, stave off bloodborne infections and dangerous open wounds, and regain power in their decision-making with the hope that they may find treatment and recovery from their drug use. I am grateful for the opportunity to share my perspective with you and applaud Nebraska's efforts to bring forward a powerful tool to combat the opioid crisis and give people a meaningful change to be restored to health. Sincerely, Jerome Adams, MD. So I was interested in learning more, and so I called him. I spoke with Dr. Adams on Friday of this past week because I wanted to understand in particular his sentence. While provisions of the sterile syringes is absolutely essential to combating HIV and hepatitis C, these programs represent so much more than syringes. And I think this is really the core of what we're discussing. Yes, there are sterile syringes provided, but it is the door. He put it this way: SSPs are about engaging people for treatment. They are the door. CDC says 5 times more likely to engage in treatment for those who are participating in this program. So yes, it is an attraction. Yes, it is a way to reduce communicable disease. Yes, it is a way to get the participant in front of people who can assess their needs and encourage and refer them to treatment. 5 times more likely to engage in treatment. He made another very strong statement when I spoke to him on Friday, and he said this: those who are addicted are going to use regardless until they get into treatment. And I think we somehow lose that understanding in our debate here, that those who are addicted are going to continue until they get into treatment. How do they get into treatment? They get in front of people who can refer them. They get in front of people who can assess their needs. He called this a one-stop shop in Indiana. That's the phrase that he used in my conversation with him on Friday. A one-stop shop. He said some of these SSPs offered food. They certainly referred to treatment. They assessed medical needs. Sometimes there are open wounds involved with addiction like this. They did all of this assessment, transportation, housing, helping the person get on the track for recovery. If there is no treatment, there is no recovery. So Dr. Alona Balasanova, the professor at UNMC, said that there is, as she put it, she says, any door, I'm trying to find her quote here, but any door that leads to treatment is the right door. And so getting these folks who have this addiction in front of people who can refer is what the SSP program is all about. That's why 45 other states are doing this. It's not to enable addiction, it's to get them in front. Harm reduction strategy coupled with enforcement. We see the sheriffs picking that up, coupled with enforcement, harm reduction strategy as a way to address our opioid crisis and the communicable diseases. Thank you, Mr. President.
Thank you, Senator Duncan and Senator Arch. Senator Raybold, you're recognized to speak.
Good morning, colleagues. Good morning, fellow Nebraskans. I stand in support of overriding the governor's veto. I think it's so fundamentally important that we really focus on local control. I know Senator Brandt already addressed that, but we're talking about our locally elected officials working with the local public health departments that have the expertise and know exactly what is going on in their counties and in the communities they serve. This is so fundamentally important. We know how dearly we cherish local control and local expertise. And I can tell you, we are beyond fortunate and blessed to have some of the most amazing medical facilities in our state of Nebraska. And it's not just UNMC, it is throughout our state. And we have cutting edge leading edge healthcare in our state, where we have nationally recognized officials, medical professionals that have spoken clearly on the public health benefits of the syringe programs. You know, the most important and fundamental thing is these medical professionals, these scientists are driven by public health best practices, scientifically proven data, and analysis of counties that have done an actual cost-benefit analysis that irrefutably shows a decrease in HIV cases and hepatitis C. Both are serious and costly infectious diseases that drive up the cost of healthcare that is actually borne by our taxpayers. You know, I read the article by Senator Kauth, and it is deeply disappointing to myself, who does cost-benefit analysis, and how they erroneously link misinformation. It talks about rates of HIV fell by 15% in counties with the new programs, but death soared. On average, syringe exchange programs led to a 22% spike in opioid-related mortality. I can tell you, any good economist would take a deep dive on that very statistic and decouple it with the erroneous assumption that is directly correlated to the syringe service programs, without fundamentally looking at the reasonable scenario that we have all read about and understood, that we have an opioid crisis in the United States, and perhaps, just perhaps, it's directly correlated to the readily available of opioid prescriptions and the explosion of the addiction to those in our country and in our state. We really need to be more empathetic to those that are most vulnerable in our state. I know Speaker Arch clearly addressed that every time an addict has that opportunity, that encounter with that public health official, that could be the day that they ask and seek for treatment. It could be on that first encounter, or could be on their 85th encounter. We know and understand that the problem with addicts is that they are prone to relapse. But that doesn't mean we should not engage in these type of programs that have a proven economic benefit, and the outcomes are so irrefutable. The important thing is there is no cost to the state, and maybe there are something that 44 plus other states know that we don't know, that they're seeing a definite decrease in the cost to the counties when they provide this service. Lastly, I worry deeply, very much, that our governor is not being served well by his advisors that are providing misinformation or misperceptions on exactly what these programs do, and that they are giving him unproven, unscientific, and not peer-reviewed analysis. You know, if Governor Pence in the state of Indiana was skeptical about these, but once they did a pilot program in, I believe it was Scott County, he changed his mind. He was open to reading and listening to the scientific evidence, what experts have advised him, but most importantly, that it clearly shows it helps the communities that we're sworn to serve. Thank you.
Thank you, Senator Raybould. Senator Jacobson, you're recognized to speak.
Thank you, Mr. President. Well, I rise this morning in support of the override of the veto on LB 307. I say that from the standpoint that, first, I want to make it clear that I have the greatest respect for Governor Pillen. I've stood behind him on all of his previous vetoes. Continue to work closely with him on legislation, and I can tell you there's nobody working harder as governor than Governor Pillen to provide good outcomes for the state of Nebraska. I think Speaker Arch maybe framed this as well as anyone has, in terms of there can be disagreements on policy. And my biggest concern really comes back to one of the things that Senator Frederickson raised earlier, is what happened? Where have we been? I want to walk us through where we've been. This had a committee vote a year ago, and the vote was 7-0, with Senator Geist present not voting. Then we came back this year with a committee amendment, and it was voted out of committee 8-0. Then we went to first round debate, and the vote was 37 yeses, 2 noes, and 8 present not voting. Then we went to select file, 31 yes, 3 no, 11 present not voting. And then we went to final reading, and the vote was 30 in favor, 30 yeses, 7 no, and 6 present not voting. That's a pretty strong support for a bill that I believe has merits. You've heard a lot of things being said about it at this point. First and foremost, let's be clear. We all talk in here about how important local control is. If we pass this bill and it gets written into law, we've done nothing other than give the authority back to the cities and the counties to pass an ordinance if they choose to do so. I think, as Senator Hunt pointed out, that will be no easy feat. But if we believe in local control, then we ought to give this to the communities and the cities and the counties and let them make that decision for what fits their counties. It's been pointed out 45 other states have passed this type of legislation. 45. Last I checked, there's 50 states. There's no fiscal note on this bill. None. When we start looking at workforce and homelessness, how are we going to do something about this? We all talk about workforce and how important it is. This is a part of that chain. I want to talk a little bit about addiction. Anybody spend any time around someone who's suffering from addiction? This is not a choice. People make a choice to use drugs, but they don't make a choice to be addicted. Addiction is a disease, and it needs to be treated. And I can almost assure you that when you look at the number of homeless people that are out in the street, most of them or many of them are dealing with some kind of mental illness, and many of them are also dealing with addiction. Not recreational drug use, addiction. Addiction is a disease. As Speaker Arch outlined, you fix this by dealing with it, by having that exchange. What these SSPs do are bringing in people who are addicted, and you're able to interface with them. You're able to have that first contact to try to get them going the right direction. I can only imagine what it's like to be addicted. But I can tell you, if no one reaches out a hand, they're never going to get better. So with that, that's my reasons for voting for the override. And I'm going to give this back to Speaker Arch for the last minute or so he can wrap up a couple comments he had. Thank you, Mr. President.
Senator Arch, you're yielded 43 seconds.
Okay, I'll talk fast. Thank you. Thank you, Senator Jacobson. I referenced Dr. Alona Balasanova, at UNMC addiction psychiatrist. She said this: "We like to say, quote, there is no wrong door to treatment, and a syringe exchange program is yet another door. While the bait may be the syringe exchange, what actually happens is that individuals who come to the SSP are constantly exposed to and are offered treatment services that we know they are 5 times more likely to pursue when it is offered to them in this way." The last comment I'd like to make is on funding, and that has to do with federal funding. The CDC has laid out guidelines that federal funding is available to establish SSPs. We're not talking about state funding, federal funding. But the first thing that you have to do is you have to demonstrate. Thank you, Mr. President.
Thank you, Senator Jacobson and Senator Arch. Senator Koff, you're recognized to speak.
Thank you, Mr. President. Speaker Archie spoke really, really fast there. That was impressive. The article that I passed out is from The Economist, and a little history. When this bill came up, I had not seen much about it, so I did present not voting the first time. I wanted to do research, wanted to speak with people in the industry, people who have dealt with addiction behaviors before. On select file, I voted no. I think that enabling addiction in any way is a really dangerous path to get started on. There are lots of places that we have those touch points with people who are dealing with addiction, who are dealing with homelessness, who are dealing with these issues. And I don't believe adding a needle exchange program is a good way to add to those programs. The article, again, is from The Economist, so it looked at things in a different way than the people in public health maybe looked at things. They found that this particular harm reduction tool does lots of harm. And again, these are people who are looking at cost-benefit analysis. They're not really for or against addiction treatments. They just want to see, okay, what does it mean? When you move this lever, how does it change that lever? Once a syringe exchange came to town, counties that offered it, rates of HIV did fall by 15%. So that is a good thing. However, as Senator Merman mentioned, there's a 22% spike in opioid-related mortality. So again, we lowered one thing, harm reduction, but yet the unforeseen detriment to that was an increase in opioid deaths. Simply lowering the risks of getting sick, just changing that, putting that safety net in place, has also been shown to possibly incentivize drug use. States that legalize naloxone, which is a medication that can reverse overdoses, opioid abuse increased. When people know, hey, there's that safety net there, maybe I can go ahead and try it. I have grave concerns about saying you can get a clean needle every time, because I think that looks at people who are on the brink, who have tried some drugs, but don't want to go to the IV route because they're afraid of that dirty needle. They're afraid of getting sick. What if you take that away and somebody says, well, no, we can always exchange the needles. We get clean needles all the time. It's no big deal. Are we removing that one obstacle that might be keeping someone away from that next step? I think there are so many other ways that we can reach out to people, that we can help them, that we can give them the information, that we can be that touch point for them. I think encouraging and enabling addictive behaviors like this is a step too far, and it's in the wrong direction. So I support the veto, and I am opposed to this bill, and I yield my time.
Thank you, Senator Koff. Senator Blood, you're recognized to speak.
Thank you, Mr. President. Fellow Senators, friends all, I stand in full support of both the amendment and the underlying bill. And God bless Senator Merman, you are so gullible. I really like you, but you should not read things that people hand to you. This information that Senator Kauth has put out to everybody, I really hope that you guys did your research and you don't stand and talk about it, because if you go to the actual article and to the research that supports that article, you're going to see that there are no graphs of raw data. There are no time served plots or scatter plots. And if you look at figure 2 on the actual article, it is bizarre and distorted. You cannot even comprehend information from that figure on A2. If you look at the research data and the news article that was a part of it, you're going to see that there were not enough counties with appropriate population to even get a level of accuracy for those figures. Instead, they've really basically left a trail of breadcrumbs from data, or lack of, to what a researcher would call estimates. This research is observational comparisons and not data-driven. If you look hard enough on the internet, you're going to find something that supports you right or wrong, but you look kind of silly when you stand up and you quote it when you don't research what it really is and what it does and what it says. To hear Senator Cass say that this enables addicts means that she hasn't listened to debate, because what we've seen in the other states is that it clearly is the opposite of enabling addicts. In fact, they are more likely to seek help. And the more likely they are to seek help, the more likely we are to help them. But let's look at the bottom line. No fiscal impact, no opponents. I voted it out of committee. It's a great idea. But one of the reasons I voted it out of committee is because there is over 30 years of research that shows it provides healthcare benefits when it comes to syringe services. We talk all the time about the fentanyl crisis, and injections are one way addicts use this drug. If you look at programs like the Take Care, Take Charge program in New York City, the first rule of thumb is that if you inject, always use new equipment. Hepatitis and HPV spreads between people who share drug use equipment. Hepatitis C virus can live on equipment for weeks and damage the liver. And there is no cure for HIV. These are people, if they remain addicts, that also end up being a burden on taxpayers because it'll be us that pay those medical bills. It'll be us that are trying to figure out how to get them off the streets. These same programs encourage and educate addicts on the Sharp Containers Equipment program as to how to use and where to drop it off so they aren't leaving needles out and about as people claim is going to happen. I want to go back to when I first came into this body. You remember how Senator Lindstrom and Senator Howard worked together on the opioid crisis. And we had multiple bills that passed, and at first a lot of people were against some of those bills. But we worked together and we did what was right, and we have likely saved lives as a result of that. This is another opportunity to do so. With that, I would yield any remaining time I have to Senator Hunt.
Senator Hunt, you yielded 1:14.
Thank you, Senator Blood. I appreciate the time. You know, keeping this just about the policy, I am not trying to make this personal.
1 minute.
But let's let it be said it's been made personal about me. That's why we're here. I don't know why anyone is working with Hunt. We can't give her anything. We can't give her anything. Is that you? And he says we? Anyway, according to the Behavioral Health Education Center of Nebraska, 88 of Nebraska's 93 counties are considered to have a shortage of behavioral health professionals. 88 out of 93 don't have enough behavioral health professionals, to say nothing of the $30 million cut that they're getting in this budget. One of our colleagues just said there are lots of services for behavioral health, homelessness services that this person said they believe is going to help these people get treatment. We don't have providers for that. We don't have funding for that. LB 307 is a permissive bill. Localities that need these services can, with the cooperation of their village board or city council, put this in place with grant funding. It's a local control bill, and we know from evidence that it's going to connect people to treatment. Thank you, Mr. President. And
Thank you, Senator Blood and Senator Hunt. Senator Michaela Cavanaugh would like to recognize 58 fourth graders from St. Robert Bellarmine School out of Omaha in the North Balcony. Please stand and be recognized by your Nebraska State Senator. Senator Vargas, you're recognized to speak.
Thank you, President. President Dorn. Colleagues, I rise in support of the motion to override on many different points, all related to policy. I thank Senator Hunt for her work on this for years. So I am supporting the motion override for LB 307. I'm supporting motion 1212. Look, try not to belabor the fact. There's a couple of points that I wanted to personally make. One, I think part of our responsibility here is when we're looking at policy to make sure we're as consistent as possible. One example of that is we often seek out healthcare professionals when we are looking to support a bill of ours. And I think it's important that we're consistent with the way that we're listening to healthcare professionals for behavioral health, for psychiatrists, for substance abuse, for people that are working in this field. Just as much as we are listening to individuals that are advocating. And it's one of the reasons why I'm thanking Senator Jacobson here. He is supporting this override and also consequently is also listening to hospital professionals and physicians on how we can better leverage funds. I'm asking us to make sure that there's a consistency with how we're listening to the experts that are doing this work. In some ways, I wish that we had a physician or somebody worked in substance abuse directly in the body. It's one of the reasons why I'm really thankful that we have Senator Frederickson that has worked in this field and adjacent to this field, but it's also reminding me that it's important when we have practitioners that are sitting in this body to be able to refute on policy and on data how important a policy or a law is. That's the reason why I'm supporting the override. And that it has nothing to do with personality, has nothing to do with the governor. It has to do purely on, I think this is good policy. I believe that when we heard the testifiers that came in, that this is a data-driven, permissive, local authority way of ensuring that we're using something that is working across the country in these syringe programs, authorizing them, and making sure that good policy is working across the country and is allowed in our state. We often have conversations, even with an education committee, about the mandates versus permissive local authority. This is a great example of creating a structure that enables the municipalities and local entities to be able to do these programs. And I thank you to Senator Hunt with the city of Fargo, just the data showing that successfully operating for 6 years, they have saved a life of 1,691 times by administering not only the naloxone provided at these programs, they have had a 25% reduction in hepatitis C transmissions, and the 345 referrals to substance use disorder treatments. There are just numbers upon numbers of data points that show the positive impact on reduction, the positive impact on enrollment, the positive impact on substance abuse and treatment numbers increasing. So colleagues, that's the reason why I'm supportive of that. I think it's fairly simple that this has been worked on. I thank the colleagues in the HHS committee for making what I think is a pragmatic, local control
1 minute
type of legislation that will do right by Nebraskans. And local municipalities, local elected officials still have a say on whether or not this goes into effect. It's good policy. It's been worked on. I thank Senator Hunt on that. And I support the motion override. And I'll yield the remainder of my time to Senator Hunt if she'll have it.
Senator Hunt, you yielded 40 seconds.
Thank you, Mr. President. Thank you, Senator Vargas. We need to let LB 307 stand and let the places like Omaha, Grand Island, Kearney, the places that want it, give this a shot. If it's unpopular in your county or your town, the local officials in your area will decide that and their constituents will weigh in. But with a vote against this, you are denying local elected officials, their constituents, locally practicing medical professionals, you're denying them the opportunity to hear from their citizens to put something in place for treatment that we know from evidence works. I would like to speak more also debunking this Pillin study. According to Dr. Ali Khan, this study looks at administrative data, not at outcomes. Thank you, Mr. President.
Thank you, Senator Hunt and Senator Vargas. Senator McDonald, you're recognized to speak.
Thank you, Mr. President. Good morning, colleagues. Just want to kind of back up a little bit with the idea of where we've been over the last few months on this bill. I rise in favor of LB 307. I rise in favor of the motion 1212. I appreciate the work that Senator Hunt and others have put into this legislation. So we on general to select, we were 37 people in favor. Select to then from select on to select, we were 31, and then on final reading, we were 30. So what hasn't changed in the bill is that it's not a mandate on local communities. It's a tool if they want to put in their toolbox. There's zero fiscal impact. That has not changed. But I'm trying to figure out what information has changed. So looking at some of the things I think is worth repeating that were handed out, this is from Sheriff Aaron Hansen, Douglas County Sheriff. As Sheriff, I support the intent of LB 307. I support a smart balance of harm reduction efforts, rehabilitation, and enforcement efforts. And he goes on to say other things, and I believe all of you still have a copy of that from the last couple of rounds of debate. Also, though, I was something from the Ohio, a former chief from Ohio, 30-year police officer, and they were talking about some of the stats in Cincinnati. Hamilton County had a SSP since 2015. All the statements made are what happens when you do not have an SSP. Ours is a public policy which is guided by state law, addresses a medical public health standards. We have had a 16% reduction in overdose deaths since 2022, another 11% reduction since 2023. SSP has been a vital component of this reduction. SSPs are not just needle exchanges. I think this part is important, not just needle exchanges. They are points of contact that help refer some of the community's most in need citizens to programs such as treatment and recovery. Our SSP has certified peers that can connect and support someone into treatment on the spot. There is a basic health care and community would not normally have access to, helps reduce communicable diseases in the community. People can be connected with transportation, housing, and other basic needs, which provide a more stable environment, helping those with addictions have a better chance to recover. If someone has statistics out there that has changed their mind on supporting this bill, I would like to see them. But I do believe this. We have to concentrate on public policy and not personalities. Whoever brings the legislation, I think it has to be dealt with fairly and sincerely, and I believe we do that. I believe we do that in this body. But if there's some new statistics that came up from the time we voted on this, from general to select to final, please show us, because I see no reason not to continue our support for LB 307 based on the success around the country on SSPs and what they bring to a community. And also, they're not mandated. It's not mandating to a community that you have to do this. It's an opportunity for that community, again, to have another tool in their toolbox, and it has zero fiscal impact to our state. I would yield the remainder of my time to Senator Hunt if she would like it.
Senator Hunt, you're yielded 120.
Mr. President, thank you, Senator McDonald. In my conversations with some of you, I've heard a lot of comments from colleagues representing areas outside of Omaha. And I've heard a lot not, for example, Senator Brandt, who made the point correctly that this is not an urban issue.
Minute.
Thank you, Mr. President. This is something that touches all of our counties, all of our districts. But some of you had said, this may be a problem in the cities, but this doesn't matter in my district. My vote count now is at about 28. And so I know many of you say that you're listening and you're going to make up your mind kind of in the minute. And I'm really asking you to, be serious here. But to say that this doesn't impact your constituents is not right. Opioid misuse is trending up in 9 of 19 local health department regions, with the highest self-reported rate of opioid misuse among adults occurring in Dakota County. Those 9 include Dakota County Health Department, Elkhorn-Logan Valley, Four Corners, Lincoln-Lancaster, Loop Basin, North Central District Health Department, Panhandle, Southeast, and Two Rivers. HIV is trending up in 5 counties. Thank you, Mr.
Thank you, Senator McDonald and Senator Hunt. Senator Conrad, you're recognized to speak.
Thank you, Mr. President. Good morning, colleagues. I rise in support of Senator Hunt's motion to override the gubernatorial veto. And I want to thank my colleagues that have added their voices to this debate through the committee process, through 3 rounds of debate, and now during this veto override process. It's already been stated clearly that this measure is a common sense measure to help our state move forward on serious issues. It came out of an incredibly diverse committee with unanimous support. There's a $0 fiscal note on it, and it had well north of 35 votes at each of the 3 rounds of debate, including during the course of debate and deliberation, some very passionate speeches in support of the measure from people who are not in the queue and who will not commit to a veto override. So that speaks for itself about what's really going on here. Additionally, some people are furrowing their brow or wringing their hands, concerned about Senator Hunt's tone or others' tone in regards to this deliberation and this motion before us today. Number one, I'm not going to police Senator Hunt's tone or any other member's tone, but I think what that tone is indicative of is frustration and passion. Every everyone knows what's going on here. This isn't about a policy issue. When Nebraska doctors and Nebraska cops, can I ask my point of personal privilege?
May I have your attention, please? There has been a fire alarm reported in the building.
Senator Conrad, you're recognized
Please proceed to the stairway next to the building.
for a point of personal privilege.
Thank you. I just want to make sure to reserve my time, and I want to make sure that since there's an emergency sound, that everybody has an opportunity to understand what's going on before debate continues.
Speaker Arch for an announcement.
Thank you, Mr. President. We will stand at ease until we have the all clear. Thank you.
Returning to debate, Senator Conrad, you're recognized, and And you have 3 minutes and 10 seconds.
All right, thank you, Mr. President. Glad everything's okay here, and I'm going to try and get back to where I was here. So I want to make sure, just to reiterate, we've had strong support of this throughout, strong bipartisan support. 45 of our sister states have already moved in this direction, and Nebraska doctors and Nebraska cops have stepped forward and said, this is going to make them safer. This is going to make our community safer. If permissive options like this on the local level help one person struggling with addiction enter treatment, that's a good thing. If permissive programs like this on the local level help keep one first responder safer, that's a good thing. And we can quote or misquote or cherry pick studies or articles that are out of alignment with the vast majority of the policy and academic and medical research on this point. But let me point out that those are academic. The folks writing most of those articles and cherry picking from those articles are not on the front lines responding to these issues in our community. So when first responders are telling us this will make their work safer, we need to heed and listen to that, unless there would be a significant body of research that says otherwise. So back to the tone, I can tell you now in my 10th year in the body that the reason that there is both passion and frustration in regards to supporters of this measure is because this is a classic sneak attack. Nobody from the governor's office stepped forward at any round of debate to ask for an amendment to show what they needed to have the bill passed. There was no dynamic cooperation or communication. Members who had legitimate principled policy disagreements gave voice to those and voted against it, fine. But many members who supported the measure and spoke in support of the measure have not got on the mic to explain why they're flipping.
1 minute.
And are flipping because the governor called them. Let me tell you, thank you, Mr. President, in 10 years here, you will find yourselves, colleagues, looking for votes on a veto override about something that's important to you. And a vote to override is not the end of the world. A vote to the override is a clear understanding of the process. You do not represent the governor. You represent your constituents. You represent your state. You have fidelity to the institution. You have fidelity to your colleagues. You have fidelity to good policy. And you move or flip or flop or sit present not voting when you have an ability to cast a vote and use your voice is wrong and a capitulation. A veto is a singular act to overrule the rule of the majority, which has looked carefully at these issues, has deliberated carefully, and there is nothing but bad personality attacks and bad partisanship coming into this debate, and it's time for us to stand up for the legislature and good policy. Thank you, Mr. President.
Thank you, Senator Conrad. Senator Aguilar, you're recognized to speak.
Thank you, Mr. President and members. I rise in continued support of 307 and the motion to override. Like most of you, I have received some emails of opposition to this override. And if quite ironic, if you've noticed, as I have, that these letters of opposition contain the same misinformation, the same misquotes that come from the governor's office. Quite ironic. And I wish some of these opponents of the bills would take the time and do half the research that Senator Hunt does on this subject. I want to thank her for her research and her efforts. She's gone above and beyond what's necessary to get a bill passed. And it's quite obvious why, if you look at the good that this is going to do. If you listen to the supporters from law enforcement, from the medical establishment, it's all there, folks. And I would urge you to vote green on this override. I'd yield the rest of my time to Senator Hunt if she chooses. Thank you, Mr. President.
Senator Hunt, you yielded 340.
Thank you, Mr. President. Thank you very much, Senator Aguilar. You know, the experience of Senator Aguilar, Senator Conrad, Senator Arch, frankly, Senator McDonald, who has experience as a first responder, and is standing up and speaking on behalf of people like Sheriff Aaron Hansen, like these police chiefs from other, from this county in Ohio, people who are telling us what we already know, which is that this keeps them out of harm's way. This reduces the risk for them doing their jobs to protect us and keep us safer. And if we pass LB 307 and someone in Grand Island or Kearney or Seward or Omaha or any community that puts something like this into place, if that helps one person get treatment, you don't know the downstream effects that that's going to have on safety for our entire communities as a whole. Reduction in crime, more safety for first responders and children and families. That's not an exaggeration, because this is what we've seen in evidence from other places that have these things in place. There have been opponents speaking on this, and they're all kind of saying the same thing that the governor said, right? But all of these things have already been refuted. You know in your heart that you can trust the process that we have gone through in this body, and that you can trust the experts who are telling you that LB 307 is a restrictive, conservative, good bill for people who need treatment. Thank you, Mr. President.
Thank you, Senator Hunt and Senator Aguilar. Senator McKinney, you're recognized to speak.
Thank you, Mr. President. I rise in support of the override, and I continue my support of LB 307. I support it for many reasons, and mainly because I think this is legislation that we should be passing in the state of Nebraska to do all that we can to assist individuals who are dealing with addiction and providing them services, but also providing an opportunity to get them help. And that should be the most important thing about this. We had conversations about other bills this year about drug enhancement, and people making arguments for the support of that bill because this bill was also important too. And now we're seeing that there is potentially it was vetoed by the governor, and then if we don't get the support to override it, these individuals are still going to support a drug enhancement without this. So it's contradictory and it doesn't make any sense, which means we shouldn't pass another bill as well if we don't do this. It's very interesting in its place about our priorities. Our arguments are not consistent. One day we want local control, one day we don't. One day we need every tool in the toolbox to help people with addictions, and one day we don't. So I'm lost for words, honestly, but I wanted to get up and offer my support for LB 307 because I think it's a very important bill, and I'll yield the rest of my time to Senator Hunt if she would like.
Senator Hunt, you yielded 3:15.
Thank you, Mr. President, and thank you, Senator McKinney. I don't need to take the full time. I will speak more to the study that was passed out and that Governor Pillen shared. One of the peer reviews in the journal stated, "We are concerned that this study is plagued by major limitations that cannot be ignored. Most importantly, this study is fundamentally flawed for testing the author's claims of a causal relationship between SSP implementation and drug-related health outcomes." The author's approach also has measurement limitations with its key independent variable, the timing, location, and scale of operating SSPs, and is problematic in its assumptions of how SSPs can reduce infectious diseases and overdose mortality at a population level. Okay, I just read a lot. I can see your eyes glazing over. Nobody understood what I just said. Fine, fine. The point is, the people who reviewed this study thought it had major limitations. You can find experts, studies, or any other form of anything to affirm any belief you have. You can find PhDs who think the earth is flat. You can find doctors who think the moon landing was fake. Just because you find a fringe outlier doesn't mean it's weighted the same as expert consensus. Besides that, what you can see before you with your own eyes, what you can see before you in communities where they've implemented SSPs and incidents of needle sticks for first responders went down. Rates of HIV and hepatitis C went down. Access to treatment for addiction went up. These things get drugs off the streets. These things help people seek treatment, and they lead to safer communities and happier communities. Doing nothing will not make the problem go away. And frankly, colleagues, we don't have another bill before us this year that's going to help these people. This is our opportunity. This is an important opportunity to save lives. Thank you, Mr. President.
Thank you, Senator McKinney and Senator Hunt. Senator Dover, you're recognized to speak.
Yeah, I rise in opposition to the veto override, and I just want to express why I'm doing that. I've heard some people say that if this helps one person to seek help, then it's worth it. And I don't know how you weigh both sides. I really don't. But my concern is, I know there are people who will not choose to use intravenous injections of drugs because they're afraid of catching HIV or other types of illness. And so I think really what's going to happen is, even though we're trying to benefit and do some good here, I think what's going to happen is some people who would never have decided to try it because of the fear of getting HIV or whatever, will try it. And I think this will actually help do the opposite of what it's trying to do, which is basically creating more addicts. I yield the rest of my time to the chair.
Thank you, Senator Dover. Senator Hansen, you're recognized to speak.
Thank you, Mr. President. This is a difficult bill and a difficult motion by Senator Hunt. I'm kind of right now still trying to figure things out. I haven't been listening to debate. That's why I was the president of voting last time. I had my staff run some numbers, and I think this is where I'm a little, not concerned, but it's creating a little bit of doubt in my mind about when states have, and Senator Hunt can mention this, and I can leave her some time if she so chooses. The states, when they have incorporated this kind of program and the percent of increase of overdose death rate compared to the ones that have not incorporated this program. And so I know, again, correlation versus causation type thing, but I think what I'm seeing with the numbers is that, you can't really argue that the states that have done this, that it works, but I think you can just as well argue that the states that have done it, that it may not work as well, based on the numbers. So for instance, I'm just going to throw out a few of them here. Ones that have been probably from 2005 or 2015, so some more recent ones like Indiana in 2015, since they've incorporated, their overdose death has gone up 120%. Florida has gone up 130%. Louisiana since 2006 has gone up 300%. Maryland, 206%. New Jersey, 2007, 248%. Ohio, 348%. I'm not taking some of the older ones. I'm trying to take some more of the recent ones because Rhode Island, they did theirs in 1994 and they went up 658%. Vermont in 2000 went up 812%. Wisconsin 94 went up 690%. And this is the percent increase overdose rate. And these are based on population change too as well. And the ones that haven't done it, such as Arkansas, since 2015, theirs has gone up 22%. Since 2005, it has gone up 174%. So it's comparables to some of these as well. Iowa has gone up 48%, Kansas 105%, Missouri 109%. Since 2005, they went up 240%. We have gone up 65% since 2015 and 128% since 2005. South Carolina 174% and South Dakota 50%. Again, I understand the states that maybe we're talking about that haven't incorporated this yet are one of the lower states when it comes to overdose death just in general, which would then argue the fact, do we actually need this program if we are one of the lowest ones in the nation currently with overdose death rates comparable to maybe other states that have, larger cities or more people who do drugs that use needles. But those are also some of the states that have the highest rate of overdose death who've used programs such as this. So I'm trying to figure out the numbers, and I will leave the rest of my time to Senator Hunt. Maybe she can touch on some of these things and clarify them for me. Thank you.
Senator Hunt, you yielded 140.
Thank you, Mr. President. Thank you, Senator Hansen. To say this is not needed because we have low incidences of opiate deaths in Nebraska is not right. And it's also not right to correlate an increase in opioid use with states that have SSPs. There are many, many factors in play. And respectfully, I would say that we don't know better than the doctors and researchers who are doing these studies that show that they're effective. Increasing HIV rates in Nebraska are the highest in over a decade. That is a reason to pass LB 307. The state has seen a 26% increase in HIV, but the U.S. as a whole has experienced a 5% decrease. We know that people who use SSPs, reduces HIV and HCV incidence by 50%. That's from Dr. Ali Khan. We know that it increases people's likelihood of getting treatment by 5 times. And we know that the best way to reduce the risk of acquiring and transmitting disease through injection drug use, we know the best way to do that is to stop injecting drugs. But for people who have not done that yet, for people who are still using, who are still facing addiction, whatever reason, this is a door. This is an opportunity for them to get treatment for the first time. And according to the CDC, new HIV infections can cost upwards of $350,000 per new infection. So we can all throw out numbers and percentages and things like that. At the end of the day, I look at the experts that I have shared with you, and I'm not trying to understand the research myself. I'm not, a lot of you are allergic to that. But what I'm saying is I don't need to go through their sources and say, oh, well, let me see if I can make better sense of it. No, I trust the Surgeon General, et cetera. Thank you.
Thank you, Senator Hansen. Senator Hunt. Senator Wayne, you're recognized to speak.
Thank you, Mr. President and colleagues. I've been on this side, Senator Hunt, more than I care to. I wear it with a badge of pride. That means that you came through this body as not having the majority vote, and you worked against the crowd to get it to the governor's office to get it vetoed. And I think that is a badge of honor. Unfortunately, I have about 3 or 4 badges like that. So wear that with the badge of honor. What's disappointing is, and I'm talking strictly to the committee that I'm on, we voted this out. And in fact, in a recent debate, I wholeheartedly agree with Senator Boslin when she said we should attack this from all angles simultaneously. And I've done just that, she said. This is not just Senator Boslin coming in and waiting to enhance a penalty to put more people in jail. That could be farther from the truth. I've supported bills from Senator Hunt that offer clean needles for those who are recovering to provide treatment information. I supported the treatment programs. It was that statement that caused me to really back off of any filibuster at 137. I thought, well, we're going to be genuine. The committee is going to be genuine about tackling this issue from all angles simultaneously. So I don't know where people are. I haven't ran a vote card. I've seen a couple of them. And I just want people to hold their word. If it's politics, just say it's politics. It's a terrible thing to say sometimes when you're talking about people's lives, but I also understand how this body works and how the nature of this, how individuals work. I understand re-elections. I understand elections. I understand talking to constituents. For 2 years, I think Senator McKinney and I went through the fire in North Omaha of everything that we did with a magnifying glass and community meetings that had 100 or 200 people in there yelling at us. So I get it. But at the end of the day, this is about the institution. And for me, if you think this is a good policy, if you truly believe this is a good policy, I don't want to see we'll do something next year, we'll work around it, maybe it's somebody's other name needs to be on the board. All the reasons I've heard for not voting for a bill or voting for an override. But at the end of the day, if this is a good policy, and if you disagree on policy decisions, we had 3 rounds for that, that's fine. But if this is about the override, then I think we're missing the point of what our job is. The override is there to do a check and balance and make sure that the policy is good. And what I'm hearing from a few people is the policy may not be good. That's fair. That is 100% fair. But those who are switching their votes because of a phone call or being pulled out into the hallway, talking to PRO or the lobby out there, or even a constituent who might pull you out and have a conversation, just explain it. Because once the vote goes up, even though it might go to a budget, even though it might go to a consent calendar, I'm going to ask why you switched your vote. And I'm going to go down the road. And if you don't think that's uncomfortable, I've done it a couple times.
1 minute.
Because I want to know for the last 20 days, can I count on your vote when and if the governor vetoes one of my bills, one of Argus's bills, one of Merman's bills, one of Reepe's bills? I want to know, because it matters. Because some things you might push when you know you got enough for an override. Some things you might not push when you know you don't have enough for an override. Because there's not a lot of time left for me in this floor. So I want to make the most use of my time. So if I can't count you to be there for 164 or 1441 or 235, these are just bills, LB 20, LB 23. I just want to know. Because there's going to be some bills, at least if you're getting the same phone calls and text messages and pulled out that I am, that I need to know where people are. So vote green on the override. Thank you, Mr. President.
Thank you, Senator Wayne. Senator McDonald, you're recognized to speak.
Thank you, Mr. President. I'm still in favor of LB 307, motion 1212. Let's say everything that Senator Hunt, myself, others have said is wrong. It's 100% wrong. At this point, if we pass this bill and we find out later on that we are wrong, then the local government is not going to enact anything. It's not a mandate. That's the point. It's not a mandate. We don't think we're wrong. We've got statistics. Senator Hunt's handed out a pile of it. We can talk to people from around the country, but if they're all wrong, all their stats are wrong and we are wrong, then no one has to enforce this, has to adopt this. It's another tool in the toolbox. And it's not costing us a dime. It's not costing us a dime. There's zero fiscal impact to the state of Nebraska. But the impact in lives, if we're right, can make a difference. And you put the value of one life, you put the value of two lives. But the idea is just not an exchange of syringes. It's more than that. It's an opportunity for these people to know that there's help out there, that there's people that want to help them. Now, again, it's not going to work. Do I have a crystal ball? Is it going to be perfect? No, it's never going to be perfect. It's put together by people. We're dealing with people with severe addictions, but we know there's people historically that have overcome with the right help. So please give this a chance. Again, it has to be about public policy. It can't be about politics, and it can't be about personalities. It's got to be about the policy that's on the board. And right now, I think this opportunity, as others have done around the country, let's not be too proud to steal good ideas and learn from other people's mistakes. Well, here we are. We have an opportunity to give an option to local government to adopt this, put it in the toolbox to help people. And if they don't want to, it's not mandated. I'll yield the remainder of my time to Senator Hunt.
Senator Hunt, you'll yield to 243.
Thank you, Mr. President. And we'll be wrapping up here, and I'll get to close a little bit. I could start now, I guess. And we'll call the House and we'll do a vote. In the legislature, this is a serious moment. Many people talk about veto overrides in the past where the chamber was hushed, where people were paying attention. And I want to thank all of you colleagues for not just the conversations with me over the last week about this bill specifically, but for listening today. there's about 5 or 6 of you, 7 of you, who have told me continuously that you will listen, that you will consider the evidence, that you're not sure where you stand, that you don't know if this helps your constituents, but that you're listening to evidence. And I thank you very much for that. And I thank the body for, just the serious attitude that's over the chamber today. This vote, of course, is not just about LB 307. It's about the independence of this chamber. Something that many watchers, many veteran staffers, many former senators have said for several years has been lacking and slipping and diminishing and decreasing. I'm a proud state senator. I'm proud to represent District 8. And I can tell you confidently that my constituents do want this bill to pass. This will help the people that have elected me, who I serve, and who I serve proudly and well. I worked this bill well. And at the end of the day, I will say that there's nothing more I could have done. One of the hardest votes we ever took, it doesn't matter even what it was right now, but Senator Chambers came over to me after that vote, and I was upset about it. And he said to me, well, did you do everything that was available for you to do? Did you do everything you could do? And I'm irritated. I said, yes. Yes, there's nothing more I could have done. And he said, well, then how can anybody ask any more of you? And I'm not kidding, guys, when I tell you, I play that quote through my head maybe 2 or 3 times a day. It's not like sometimes, like that's probably become one of my most guiding mantras, I guess. If I've done everything that's available for me to do, no one can ask any more of me. And that's how I get through my time in this body.
Senator Hunt, you are recognized to close on your motion.
Thank you, Senator Doran, Mr. President. So I've done everything I can do, and the rest is on you today. The rest is on you. Please listen. The rest is on you to stand up not only for your constituents, but all of ours, all of the people of Nebraska who we know can benefit from LB 307. Not just the people it will affect, but the law enforcement, the first responders, the experts who have already given us the research and data and the evidence from 45 other states to show us that this works. And Nebraska's bill, colleagues, is not like those other states either. You know why it's better? Do you know why LB 307 is better than what any other state is doing? Because this bill is about local control. It's saying, Grand Island, if you'd like to have a syringe service program, your city council has to approve it. They have to go through that whole process with their constituents. It has to be run by a behavioral or public health provider. And it has to offer treatment. Read the bill. Too late for you to read the bill now, but it has to offer all kinds of treatment and services that we know is going to be the bridge for these people to get help that they need. I think that we have a lot yet to accomplish in this session. And that's why I think this veto was very foolish on the part of the governor. We were sailing along, and I would like to continue to do that because we have a lot more controversial things before us that I think we should have saved the drama for, honestly. Finally, you know, what more can I say? But finally, I have to thank my staff. Hannah Murdoch and my staff, this is her bill, honestly. Like, she has done so much research and so much work over the last 2 years on this. She's become an absolute expert in this subject matter. She has managed experts. She's connected many of you to experts, like Dr. Adams, who spoke to Speaker Arch. She's helped me with all my preparation, obviously, and I just want to thank her publicly and just share how grateful I am to have her on my team. And Cassie Ross, who, you know, takes care of us in the office and has managed all of the constituent contact. And people reach out to us all the time, as they do to you, and they say, misinformation about this bill, and they're confused about it. And what does it really do? Are we giving free needles? Things like this. Is it taxpayer funded? Why are we having government pay for needles? This and that. And Cassie is the one who has delicately and intelligently broken down these arguments for people and gotten them on our side. And that's politics at its best, isn't it? When you have an idea, you do the work to put it into place, you convince the people who are on the fence, you introduce an amendment to pull off opposition and get it to a place of compromise where people can agree with it. And then the 49 people who were elected to represent the best interests of the people they serve say, you know what, we think it's good. End of story. What happens on the board today is not because of the policy. And I encourage you to protect your reputation as a senator, to protect your legacy here during the short time you have in your life in this body, by taking a vote with integrity that's about policy, that is not a personal vote, that's not because you think the governor can do something for you that 49 of us can't. And that's something that you can be really proud of. Okay. All right. Thank you, Mr. President. I ask for a call of the House.
There's been a request to place the House under call. The vote is, shall the House go under call? All those in favor vote aye. All those opposed vote nay. Record, Mr. Clerk.
34 ayes, 1 nay to place House under call, Mr. President.
The House is under call. Senators, please record your presence. Those unexcused senators outside the chamber, please return to the chamber and record your presence. All unauthorized personnel, please leave the floor. The House is under call. Senator Brewer, please return to the chamber. The House is under call. Senator Brewer, please return to the chamber. The House is under call. All unexcused members are now present. The question before the body is the override of LB 307. This motion requires 30 votes. Mr. Clerk, there's been a request for roll call vote. Please call the roll.
Senator Aguilar. Voting yes, Senator Albright. Voting no, Senator Arch. Voting yes, Senator Armendariz. Voting no, Senator Ballard. Voting no, Senator Blood. Voting yes, Senator Boston. Voting no, Senator Bostar. Voting yes, Senator Bostelman. Voting no, Senator Brandt. Voting yes, Senator Brewer. Voting no, Senator John Kavanaugh. Voting yes, Senator Michaela Kavanaugh. Voting yes, Senator Clements. Voting no, Senator Conrad. Voting yes, Senator Day. Voting yes, Senator DeBoer. Voting yes, Senator DeKay. Voting no, Senator Dorn. Voting yes, Senator Dover. Voting no, Senator Dungan. Voting yes, Senator Erdman. Voting yes, Senator Frederickson. Voting yes, Senator Holleran. Voting yes, Senator Hansen. Voting no, Senator Hardin. Voting no, Senator Holcroft. Voting no, Senator Hughes. Voting no, Senator Hunt. Voting yes, Senator Ibaugh. Voting no, Senator Jacobson. Voting yes, Senator Kauth. Voting no, Senator Linehan. Voting yes, Senator Lippincott. Senator Linehan voting no. Senator Lippincott. Voting no. Senator Lowe. Voting no. Senator McDonald. Voting yes. Senator McKinney. Voting yes. Senator Meyer. Voting no. Senator Mosier. Voting no. Senator Merman. Voting no. Senator Raybold. Voting yes. Senator Reapy. Voting yes. Senator Sanders. Senator Slama. Senator Vargas. Voting yes. Senator Von Gillern. Voting yes. Senator Walls. Voting yes. Senator Wayne. Voting yes. Senator Wishart. Voting yes. Senator Linehan voting yes. Vote is 27 ayes, 20 nays, Mr. President, to override the gubernatorial veto.
The motion is not adopted.
Call.
Raise a call. Mr. Clerk.
Mr. President, some items. Your Committee on Enrollment Review reports legislative bill 43, 61, 198, 204, 304, 905, 938, 1087, and 1104 is correctly engrossed and placed on final reading. Your Committee on Enrollment Review also reports legislative bill 894 and 906 to select file, with 894 having E&R amendments. Your Committee on Agriculture, chaired by Senator Holleran, reports legislative bill 1301 to general file with committee amendments. Your Committee on Health and Human Services, chaired by Senator Hansen, reports legislative bill 874 and 1350 to general file with committee amendments. Amendments to be printed: Senator Dungan to LB 857A, Senator DeKay to LB 1301, Senator Ibaugh to LB 894, Senator Dungan 1074, Senator Ibaugh 1368. New A bill, legislative bill 993A, introduced by Senator Ibaugh. It's a bill for enacting appropriations to appropriate funds to aid in the carrying out of the provisions of legislative bill 993. Notice committee hearing from the Agriculture Committee as well as the Business and Labor Committee. Finally, Mr. President, a priority motion. Senator Dover would move to recess the body until 1:30 p.m.
Colleagues, you've heard the motion. All in favor say aye. All those opposed say nay. We are adjourned. We are recessed, not adjourned. We're recessed.